I'm so pleased to introduce you all to Lieben Gebra-Mikhail. As the first executive director of Taibu Community Health Center, Lieben has led the organization for the past 14 years. Today, Taibu has strong community roots and has become a recognizable agency that is committed to addressing the impact of anti-Black racism on the health and well-being of Black communities. Lieben has over 30 years of experience in primary health care, social services, mental health, and community capacity building and development field. He holds an MA in Migration, Mental Health, and Social Care from the University of Kent in the UK, and a Master's Certificate in Healthcare Management from the Schulich School of Business. He's completed Community Health Leadership Program at the Rotman School of Management. In 2021, he completed the Strategic Perspectives for Nonprofit Organization Program at the Harvard Business School. In 2021, under his leadership, Taibu received the inaugural Scarborough Hero Awards for its contribution to the response to COVID-19 and the Black Health Alliance Legacy Award for excellence in community engagement and health promotion. In February 2022, Taibu received the Outstanding Organization Award from the Jamaican Canadian Association. Please join me in welcoming Lieben.
Thank you very much, and it's a great honor and privilege to have been invited to speak at this conference and on an important subject of health and of a very racialized, marginalized community. So I'm very pleased and honored to be here. The title of the presentation is "Moving Up from the Cliff, from the Bottom of the Cliff," and I'll speak a bit more about why this cliff and what this cliff represents. But before that, I think it is important that we acknowledge the land that you know, from where, at least from Taibu's perspective, we operate and where we're located and situated today. I won't go through reading this script, which is important, but I also want to just present my own personal reflection around who I am as a settler on this land. I've been invited, you know, through this spirit of caring and sharing, and I'm privileged to be raising my family, working, and having a civic life on this land. But at the same time, I'm also very, you know, aware and recognize the challenges that Indigenous communities face on an ongoing basis, and I have a duty and responsibility not just to reflect, but also to be part of a solidarity and allyship with the community towards the truth and reconciliation and action moving forward. I also would like to kind of pay attention, recognition and pay tribute to people who have passed before me, who have come on this land, stolen from you know, their homes through the transatlantic slave trade. And so I also honor and pay tribute to the ancestors of African origin and descent. Before we go into the conversation, just a little bit about Taibu. We are a community health center that provides primary health care, health prevention, health promotion, and community development work located at the in Scarborough. But our mandate is to serve the Black population across the GTA. We've had added certain priority populations over the years. We serve all the residents of the Malvern neighborhood. We also support the Francophone communities in Scarborough, and we work with the Scarborough Mental Wellness Advisory Council to support the Indigenous communities in Scarborough as well. Our board has 3 strategic priorities. It's now under review. These are looking internally and building a strong organization that is efficient and resilient, to make sure that the work that we do is part of a strategic partnership and alliance, and of course raising the issue that we address, and we can move towards action and change. I'm going to skip this because this has already been mentioned in the bio, but just one more item there is that we are an accredited organization, which is an important component through the Canadian Centre of Accreditation, and we have to meet about 318 indicators, making sure that we are a trustworthy organization. We're part of a larger association of community health centers, and we have what we call the model of health and well-being that has significant components such as, accessibility, community governed, leadership, population needs based programs and services. But as an organization that is grounded on serving the Black community, we have worked over the past 5 years in developing an African-centered or Afrocentric approach to the programs and services that we do, so that when we meet our clients' needs, it is making sense and representative of their needs as well. So we have used, for example, the Kwanzaa Principles as a way of formulating our philosophy, service philosophy, and I'm going to share some examples here. As you can see here from the slides, cooperative economics, or the principle of Ujamaa, is about being accountable and efficient organization. The principle of Kumba, or creativity, is about innovative model of care and quality. The principle of self-determination, making sure that we work with our clients and the communities, and there's nothing that we do without their involvement and participation. The principle of collective works and responsibility, or Ijima, this is about building and maintaining a community together. The purpose, the Imani principle of Imani, is about looking at the person, whole person care, which includes not just physical health, emotional, social, and spiritual health. The two other principles that we have adopted is unity as well as purpose, and making sure that racism and intersectionality is part of our analysis, systems planning, and program delivery. And this is the model that we have developed with 3 very important goals of prevention, restoration, and advancement. And I'll focus on these 3 goals and how we are moving from the cliff, from the bottom of the cliff up. We're going to be focusing on those, and we're talking about how we are addressing anti-Black racism. The analogy of the cliff is something that I got introduced a few years ago through a great public health official called Dr. Kamara Jones. She's from the States. She's an epidemiologist, a physician, but has done a lot of work around addressing anti-Black racism in the healthcare system. And the idea of the cliff here is that there are a lot of people falling down this cliff. And as you can see in our situation, we have overrepresentation of Black, Indigenous, racialized communities that are falling down the cliff. Many times, service planning, service delivery, and attention is predominantly focused at the bottom of the cliff after people have fallen down. So, for example, some issues that we are very focused in addressing in our communities is community safety and youth violence. Every time there is a youth violence at the bottom of the cliff, we have focus and attention and investment, let's say, on police safety or community safety, all right? And so we can say, oh, there's violence in our community, we need more police and safety, so we're going to fund police, and that's where the focus and attention is. We know that's not where the solution should be, and we know that's not where the problem exists. Sometimes when government institutions, organizations are a little bit more progressive, we try to put a safety net to say, oh, let's catch people falling, at least, and do something about it, and that's okay, but I think that's not also what helps communities, and particularly racialized, marginalized communities, and we'll see why. So we need to move up from the bottom of the cliff, and that's where maybe we need to put a fence or a wall to stop people from falling down the cliff, and that would be a solution to the problem, or partly the solution to the problem, I should say. Because I think the other thing that we have to do is to move people away from the cliff altogether, and that's where I think most of the work should happen. So with this now in mind and in our context, when we bring those three ideas that I shared with you, the goal that we have as an organization in addressing anti-Black racism, we can think about, at the bottom of the cliff is about restoration. This is where we need to restore people's health because they're already been impacted, and that's where our focus would be. If we are more progressive, we think about prevention, and that's where we put some barriers and stopping people from getting ill, for example, or addressing some of the social determinants of health before people get severely impacted, and it's very difficult and costly after they've fallen down the cliff or while they're falling down the cliff. And then the advancement is about moving people away, and this is where health promotion and supporting people, building their capacity and maintaining their health and self-management and self-support comes into place. And within that, as I mentioned earlier on, there are those principles that we use when developing and designing programs and services, even interventions that would make sense for the communities that we serve, so that when they come to program and services, they can feel, they can see, and they can sense that this is about them, this is for them, and this is also by them. So this is how we have been developing our model, service model, in terms of moving people up the cliff, but also introducing all the social determinants of health, and through a lens of African-centeredness and culturally affirming practices and services. So some examples maybe that I could share with you. For example, with restoration, this is mainly focused on our primary health care. So we have our providers, doctors, nurse practitioners who deal with hypertension, diabetes. We focus on health situations that disproportionately impact Black communities, such as diabetes, hypertension, sickle cell disease, and things like that. And very recently, we've just launched a program and service around lupus. Lupus predominantly impacts Black communities. There are a lot of challenges through the healthcare system. Diagnosis takes a very long time. People are not very aware of the disease and how to support our communities. So we do focus, even when we're providing primary care or primary health care, we focus on areas where our communities are very much impacted by or disproportionately impacted by. I've spoken about diabetes education program. You know, we have a low back pain program that addresses people who have chronic and acute back pain, and supported through a chiropractor and a kinesiologist, and so making sure that that is very comprehensive as much as we can. Examples such as the Scarborough Perinatal Support Program, and this is supporting new parents, and this is a model that has been developed in partnership with public health, the hospital, Strides Toronto, and VHA Home Healthcare, trying to kind of provide them with a very comprehensive support, with one-on-one group support, psychiatry support, and also some social activities that they can engage with. As I mentioned earlier on, we have a very sophisticated and broad Francophone programs and services, specialized primary care services, but a lot of health promotion programs that addresses youth, adults, and seniors in the Francophone community. So these are some of the restoration programs that we have. In terms of prevention, we do a lot of engagement with our communities, whether it is lifestyle modification programs. Here on the picture, you will see the Black Health Challenge. That is a combination of education and physical activities, but with culturally appropriate education as well as physical activity. So we use culturally appropriate music to get people to move, and it has been very, very successful. We have about 6 or so locations. We used to have physical location, now they're all on Zoom. And what happened, we used to, we had a lot of women participating in school gyms with physical activity and education, and we were trying to engage men into this kind of program. And a couple of men would come to the gym and they would see they're the only ones there and never show up again. So we had some inquiry and said, why is this and what can we do? And then we created a separate program called the Black Men's Health Challenge that is now delivered in gyms with male coaches, and the environment is more men friendly, and we put in some challenges there with men. Men like to be competitive. And so we measure people with their blood pressure, blood sugar, BMI, and things like that, and then do a challenge throughout the course of the year to see who has had the most impact. And now, this year, through some funding that we received from Peloton, we are developing a Black Youth Challenge, which is a combination, not so much around health education, there's health education, but things like leadership qualities and other things that youth would benefit from, using physical activity like boxing and gym activities, and again, very youth-friendly with youth physical instructors. Just let me move on. And then some other prevention related to the pandemic, as we're still in the pandemic, almost, hopefully, getting out of this pandemic. But some of the things that we did around prevention is communication, engagement, outreach, and encouragement for our communities, particularly the Black community, who were, number one, disproportionately impacted by COVID, but also there was a lot of misinformation and stigma and things like that. So we started with the campaign, get the facts, get tested, and get support. And then when the vaccination rollout started, is to make sure that we had a culturally comfortable and safe space for our clients and communities to come and participate in the vaccination. Again, doing a lot of education, engagement, taking time to develop trust. And so some of the practical things that we've done is making sure that the staff is reflective of our communities. We partnered with the Black Physician Association and making sure that the doctors who were vaccinating and the nurses who were there were Black. So people, when they came in, they had the opportunity to feel safe, comfortable, but ask questions. And if they would sit there with the doctor for half an hour and get some education and questions answered, then we would let that happen so that people had the time to really make informed decisions. We couldn't convince people, but we could provide them with the right information for them to do that. So we looked at restoration and prevention, and then advancement. Some of the things that we have been doing is really getting into community advocacy initiatives and education and engagement initiatives, such as the Black Mental Health Day, and now it has become the Black Mental Health Week. This is a partnership that we started with the city. The city was thinking about developing, they do this annual campaign, it's called the Toronto for All campaign, and they've done a lot around, racism, Islamophobia, homophobia, ableism, and they approached us to do something around anti-Black racism and mental health in the Black community. And we just didn't want to have a campaign that just happens in February with posters around the city, and then it ends after February. So we collaborated with them and worked with them to have something ongoing. And the Black Mental Health Day was born out of that. So in 2020, the first day in March, the first Monday in March, was declared by the mayor as the Mental Health Day, Black Mental Health Day, where we had conversation, discussions, educations, a lot of events happening throughout the city. And then 2021, that became a week, so we have a week where we engage people. So we do a lot of education, conversation with youth, adults, seniors throughout the city, but now it has taken, other cities have followed. So across Canada now in March, the first week, Black Mental Health Week is being celebrated. The other thing that we do around advancement is about community capacity building. And one of the things that we have been very successful, as an example, is the seniors engagement strategy that we have developed. When we started at Taibu in 2008, we really wanted to get away from having programs for seniors such as bingo and arts and crafts, which you still do, but we want to do it in a different way, and we wanted to make sure that the seniors are engaged, have a say, and make decisions on what kind of programs they want to see in our communities. And so we did an extensive needs assessment and asset mapping for our seniors, and through that we have now the Ubuntu Village, we call it the Ubuntu Village, where we have an elder council that decides on all seniors program, actually in the north of Scarborough. We have extended it, and now we are extending to the south of Scarborough and the West End. And the idea is Ubuntu is a Zulu language, and it means I am because of who we are. And so most of the seniors are from environments where we don't have social structures, we don't have social workers. The neighbors are the social workers who are providing the services. And so we wanted to create that virtually where we are, so that they can come together and develop this village where they are looking after each other. And today we have about 200 seniors who are actively engaged in developing and facilitating programs. We have about 40 programs during the week that happens, that is facilitated, supported by staff, but facilitated by the seniors. So some of the programs could be exercise programs, and we have developed the capacity of the seniors to become seniors gentle exercise instructors. We have laughter yoga facilitators. We have a group called the Writers Group, who have published 2 books so far. So this is about them being part of the community, developing the services, but also being active, and so they can age successfully at home without having to rely they rely on services, but rely on each other more often. Other programs such as Advancement is the project we're working now with some funding we received from Bellet's Stock. It's called the Healing Circle Project, and this came out of the Black Mental Health Week, and also after the impact of George Floyd 2 years ago, where we are now using African-centered rituals and ceremonies and coming together to develop some kind of a mental health support and network in the communities. And part of the work that we want to do is we want to move away on relying on funding all the time, and so creating some sustainability and community capacity in the community. We need to move very, very fast. Another advancement is now we are the lead agency in Scarborough to lead the non-police community-led crisis response. This is also a huge undertaking that has come up after the death of Regis Korchinski-Paquette. The city had an extensive consultation in the community to move away from police responding to mental health crisis. The idea is if somebody has a heart attack, the police don't respond. It's healthcare professionals who respond to those kind of crises. Why is it that when it is mental health, the police is responding? So we are now having a community-led crisis response, a mobile community team with outreach and also post-crisis case management. Time is running fast. The other most important thing as we move from the bottom to the top of the cliff and away from the cliff is really about thinking about systems change. We are moving from just doing programs all the time, because we know programs are important, but programs can only do so much. An example, we have a project that deals with the disproportionate suspension and expulsion of black students in schools. And so we have a program that deals with that works with black students, that does some prevention, that does some early intervention in schools, and if necessary to support black students and their parents through legal representation if they have to address some of those racially biased disciplinary measures. But if the school system does not change, we will just be looking for more money to do the same thing over and over again, year after year, and supporting those who are impacted. So we really have now moved away from community programs to systems change program, and that way we are influencing the system, and if the system change, then we don't need these special programs, or we are going to improve the experiences and the quality of life of our communities, whether it is in schools and having positive school experience, mental health being significant, or supporting black students or black youth with education, employment, and training. So that's the kind of thing that we are also incorporating. In addition to the Afrocentric principles and values, we are also incorporating a systems change idea. So as we move from the bottom of the cliff away from the cliff, we are staying away from the cliff. Otherwise, it's going to be this vicious cycle of going through programs all the time. And we've also added something, and I was just sharing earlier on, a board governance and leadership project, because we know if policymakers do not also change, that's where decisions are made, policies are made, funding allocations are made. If those spaces do not change, then nothing much would change. So we've also added another program called the Board Governance and Leadership Project that addresses anti-black racism in boards. It also, in how we design programs, we're also making sure that there is a system component in there. When we talk about school discipline, for example, it's not just a behavioral issue. There are so many things that are connected that we need to be paying attention to. And most of the times, particularly with black students, when there is an issue of symptom of behavior being displayed, we only focus on that, and with prejudice that we have, we consider those as being defiant behavior or thug behavior or whatever it is, and not so much with other students, for example. So we look at what is around the student and how are parents coping, what is the school environment, are there any other individual students' needs or mental health components, and then trying to address the issue similarly. I think it's the same thing when we're talking about the employment component. It's the same thing. There are so many social determinants of health affecting youth that employment is not just employment. Employment is connected to housing, connected to poverty, connected to school experiences. All those kind of things have to be looked at. So we're not just thinking about the system out there, but also the system that is around youth in addressing those. We also have an academic success mentorship program called the LEARN program, and also that's what we're looking at when we are developing those systems. So, and the Ubuntu Village, again, we talked about that earlier on. So when we're moving from the bottom of the cliff upwards, we are making sure that we are following culturally affirming values and principles, in our case, the Afrocentric values and principles. We are also thinking about systems change and trying to impact the systems around the communities that we're serving, but we cannot do this by ourselves. So collaboration and partnership has been very important in the work that we do, moving from the bottom of the cliff upwards and remaining away from the cliff. And so we do a lot of the work through our partnership, either, universities, research components, or community grassroots organizations, or other kind of stakeholders in our communities and beyond. Collaboration and partnership is very important. A couple of other things that we also do, we develop resources. So this is about self-management, support that people can have and make decisions. So we do resource guides, whether it is sickle cell, whether it is low back pain, or whether it is, faith-based suggestions that would be helpful for our communities. This is the reflection. This is one of the publications from our seniors. They, as they were coming together, they wanted to share their experiences of coming into this country, the good, the bad, the ugly, and so they wrote this publication, this book called Reflections Through Our Stories and Paintings. It's also based on Afrocentric values, because we know storytelling is a very, central ingredient of traditions passing from one generation to another. So this is what the seniors have been doing. And finally, we're also engaged, and this is very, very new, so we just finished the project, and this is about experiences of people in the workplace. So we've been working in developing a documentary called Working While Black. It's just being screened. Actually, we've had so far about three screenings. There is going to be one screening in Halifax tomorrow, and another Francophone screening, and one in Toronto very soon, sometime in June. We're just finalizing the dates. But this is about the experiences of people who have experienced anti-Black racism in the workplace. And the aim, there are two aims about this documentary. The first one is to generate conversation among ourselves, because we don't talk much about what's happening in the workplace. But most importantly, we also want to use this documentary as an engaging tool, a training tool for workspace environments, institutions, organizations, to try to address what is happening in the workplace, so that when people of African descent enter a workspace, there is an inviting environment, an encouraging environment, which we know and studies have shown, and it is also reflected in the documentary. When people are happy in a workplace, they are more productive, they want to give more. So these are the kind of things that we try to do in order to address anti-Black racism, moving from the bottom of the cliff upwards and staying away from the cliff. Thank you.
So thank you very much, Lieben. As I noted before the presentation, we'll now have a question period, and I would ask that attendees submit their questions through the chat feature on the right-hand side of the session page in the virtual portal. We'll do our best to answer as many questions as time permits, and thank you for your understanding if we don't have time to answer your question. In order to accommodate questions from as many members as possible, we'd ask that you limit yourself to one question only. So interestingly, there are a number of comments about the cliff analogy, and finding it a really interesting and useful and intriguing analogy for healthcare. So there is a question here about where the member can find more information on this cliff analogy.
If you Google Dr. Kamara Jones' cliff analogy, she has some very, very great videos out there with some good examples. But yes, it is the moment I saw it, I said, this is exactly the reality, and I think it also gives us a visual of how we need to address the issues that many racialized Black indigenous communities face. They are very, deep-seated, and we only see the symptoms and not understand where the root cause is coming from. Mm-hmm. And so if we don't address the root cause of issues that are happening, we'll always be trying to put fire out without going to where this fire is, the source of this fire is. So that cliff analogy really gives a very, very good visual for understanding the complex situation that most communities face.
Mm-hmm. Thank you, Lieben. There is a suggestion in the chat about, or a comment I should say, about Taibu influencing much social change and the importance of this. A question, do you have any advice on how to convince organizational leaders to invest in this kind of work, meaning anti-racism initiatives?
Yes. So yes, first thing is, I think, conversation. I believe that we are in a very, opportune time that we have right now that we cannot miss. The painful experience of, the murder of George Floyd, the pandemic, has created an environment where there's a lot of willingness to engage with this issue. We've seen unprecedented engagement from institutions and organizations that have never even cared about social issues before, corporations. And so we've seen that engagement. At least at Taibu, we've seen quite a lot of organizations approaching us and say, we want to do this and we want to do that, and we want to give you money. And there's been a lot of giving money over the last 2 years. And what we say in our response is, we want the money, it's good, thank you very much, but we want more than the money. We want a relationship and engagement, because the money is a one-time transaction. we want transformation. And so we say, we want to engage with you. You know, how can we help you deal with anti-Black racism in your own space? Or how can, you know, you have resources, you have technical knowledge, you have skills. How can we leverage that to improve the conditions of our communities on a long term? We'll take the money, you just give us the money, but we have more work to do. So I think there's an opportunity now where we can approach organizations with saying this is important. We've been busy at Taibu with the Black Governance and Leadership Project, where we have been approached by many organizations. And so that's that. I think we had an opportune time. It's very, I mean, and I'm not naive, because the system is a system. And so it also takes some consideration from organizations to see the benefit for the organization, why doing this is important. I just gave an example about the Working While Black documentary, and we're getting some feedback. And one of the things is, if you really, I mean, if you don't care about the issue, but if you try to address the anti-Black racism, there is an economic benefit in doing this. Because if you have satisfied workforce, you have increased productivity, which means increased profit if you're in a profit business. So even if people are only concerned about their organization, there is some way of having a conversation. The truth is, though, it is the right thing to do. But conversations with systems is difficult, but it has to happen. It doesn't, you know, it takes time, it takes persistence, and, you know, if some people are interested in bringing this kind of conversation, we're happy to be participating in that and supporting and strategizing and planning and supporting people from inside the organization to be able to do that.
Thank you, Lieben. There was a question about whether the documentary is available anywhere online where people can access it.
Not yet. We're just completing the project because it's a government-funded project. That's why we have a few screenings that we have to do, and then wrap up the project, submit our reports, and then we're also receiving some very good feedback about how to improve on the documentary itself and how best to use the documentary as an engagement tool moving forward. So once that project is complete, at the end of June, maybe July, then we would have a plan of rolling this out. If people are interested to bring this to their own space, I don't know, you know, they can contact the college. You have my contact details, and we'll be very happy to bring that to workspaces. We're already getting a lot of emails. People who have shown it, they say, oh, I have to take it to my leadership team. I have to take it to my board. So we're happy to get that rolled out.
Well, that's great, and we'll stay tuned. So I notice that there's a comment about all of the important work done at Taibu, and CHCs, the work that CHCs do, community health centers do generally regarding anti-racism in all communities. Your leadership has a great impact on the work completed by Taibu. Another comment as well about hearing about the collaborative seniors programs in particular, and a question about whether the resource guides that you referred to are widely available or just for clients of Taibu.
They can be made available to other stakeholders, communities as well. We get requests, so that's also another request that can be provided for us.
Again, there was more thank yous about this important work. And then a more specific question, very specific question: how do I address a friend who lays the blame on Black celebrities who do not do enough, in her opinion, to help their communities?
I think that's a fair comment there. We all have responsibilities. I don't know, if they're doing more or not. But from us, from our perspective, really, information awareness that helps people to move towards action is going to be very important. I know there is some work being done. There is a lot of work to be done. There was a question at the beginning saying, I hope this session is not going to be depressive, right? When, we're all, at least I am always moving from the overwhelmingness to the hope, the overwhelmingness. And partly is because we do a lot and then we realize there's more to do. We engage a lot of people and then we realize there's more people to engage. Some people who really can support initiatives like this. You know, and then we also find that a lot of people say, oh, I didn't know Taiwo existed. I mean, they live just across where we are. So there is a lot of gaps there, and I think as an organization, we have now a plan to have some kind of a strong communication component to raise the issues to the people who really might be of help. It is very important as an African principle that we, right, does not exist in African tradition. Ubuntu means I am who I am because of who we all are. And so that kind of a communication with different stakeholders, people who are in power, people who have influence, people who have resources, people who have connections. I think we have a lot of responsibility, and it's something that we have to continue to work on. And so maybe that's an idea that is given to us, and then we'll start communicating with celebrities. I mean, we use celebrities, and we've used celebrities at Taiwo, where they come and talk to young people in motivating them and being a role model. Maybe there's more to be done there.
A specific question about whether there are any black men's groups for ages 35 and up.
No. But if there's a need, definitely. I mean, we've tried a lot of, you know, I'm one of the people who admit that I don't engage with health services, health information, right? That's me, that's men. But we've done a lot of engagement. So the Black Mental Health, the Black Men's Health Challenge has engaged a younger generation. And so we're also looking at that and seeing the younger and the older generation coming together and doing some intergenerational components. So in one of the cohorts, we had younger, 18, that age group, a younger age group, with seniors who are 70 who are coming for physical activities and bringing that conversation. And I also know an older parent brought his son. His son was coming to drop him to the Black Men's Health Challenge and then slowly brought him into the program and they stayed. So there is that connection, but it is a challenge. We have a Black Men's Health group, a Black Men's group separately, and we want, and they are really wanting to work with the younger age group because they say, we really want to work with younger age group and provide some support. Some, generational kind of a tradition of passing on certain values and principles, particularly. So it's work in progress, but there's a lot of work to do with men of that age group, 35 to 50.
Mm-hmm. And kind of a related question, Lieben, how is Taiwo addressing mental health in Black men in particular?
So mental health request and need for mental health services has gone through the roof. After COVID and significantly after the George Floyd incident. And we had challenges in reaching out to our Black communities for mental health services, particularly younger age group. But over the past 2 years, we have seen a very increased demand for mental health services, especially for younger age group, including, young people in schools. And we're working with 3 school boards right now in providing mental health support for youth and their parents, particularly as summer approaches. Is always a challenge because there's a gap there and there's no support for youth. We're also seeing some increase in Black men's request for mental health support. But mental health support, and particularly in community services, is very under-resourced. There is a capacity issue there. And, we always mention that to government institutions and funders. But we have seen an increase in mental health services, including men. It's a good thing in one sense, but we're also being very, aware that the conditions that people are going through must have been significantly overwhelming, that they are now coming to seek services and support. Before, maybe they were just managing it, hiding it, suppressing it, but now when we see this rise, particularly from black communities, when we know stigma plays a significant role, it is giving us an indication that the situation is very, very dire. And so we are concerned that there's not enough capacity in communities to provide those services.
Kind of a question that relates to that as well, Liban, and that is, which professionals provide the counseling?
So we have social workers. We have what is called the structured psychotherapy program that is launched by the province. So we have a psychotherapist. It's a bit limited to the kind of issues that predominantly exist in our communities. The psychotherapy program is predominantly mild to moderate depression and anxiety. Right now we have been pushing so that they also include trauma and trauma-informed care and PTSD. This is what we witness within our communities. So we're getting there. And then for some of the programs, we have some psychiatry, in-house psychiatry support, like the perinatal support group, that maternal program that we have. And now for the community crisis, we have embedded, because we're learning as we go along, so we have embedded some resources and budget to have some psychiatry services be available internally, because it's very difficult then to refer out for any support, consultation, assessment, treatment out there. Waiting list can take up to a year. So we have embedded some services, but it's not enough. So it's predominantly social workers, psychotherapy, and now some kind of psychiatry support.
Thank you. And a question about what the Black Men's Group is about.
The Black Men's Group is about a couple of things. One is just a space for them to come together and just have discussions, whether they want to play dominoes or cards or whatever. It's a social kind of a networking, so that people are not isolated. Then they also identify what kind of information do they need. What kind of health information do they need? So is it around mental health? So we would invite mental health guest speakers. Is it around prostate care or men's health, hypertension? So we also include some kind of health education promotion. And then they identify some of the projects they want to do, whether it's engaging youth or, raising funds, maybe do some cooking sessions. And so whatever their need is, we try to accommodate that. But it's just created a space for them to come together and decide what they want to do as Black men.
Thank you. And I'm going to insert my own question here, because I was really interested to hear you talk about the importance of programs, but also of systemic change and partnerships. Is there anything about the Community Health Center or CHC model that you feel positions you well to address issues of anti-Black racism? Yes.
I mean, the CHCs are created for really, for the needs of communities. It's not just medical services. It's really looking at communities' need and responding to communities' need. And so that is, I think, a foundation for any kind of equity issues you want to work with, whether it's anti-Black racism, indigenous-specific racism, or any kind of racially based kind of challenges that communities face. The multidisciplinary approach that we have, the community governance, the boards are from the community, so they set the direction, the tone of the organization and where this organization should go. Those are, I think, our foundational pillars that would make things easier to address issues of equity. And equity is also very centered, especially now for the past, maybe I would say 6-7 years. Equity has been the central kind of foundation for community health centers. Just on Tuesday, we had the AGM of the Alliance and unveiled the new strategic plan. And the vision is about, making primary health care as the foundation, of primary care through the equity lens. So equity is at the center of how CHCs operate. And so that gives it the permission and the mandate to be able to really investigate, inquire, and find out what is it about the communities I'm serving, whether it is rural, whether it is urban, whether it is a Black-focused CHC like Taibu, or a CHC focused on youth, CHC focused on women, like the Women's Health and Women's Hands. And so even if they don't have any kind of specific population, how they serve the communities is through the equity lens, and that makes it, you know, a very good ground and space to be able to address issues anti-Black racism.
Thank you, Lieben. I wondered, as sort of the follow-up question, how you would see the contributions of social workers and social service workers in the community health center context.
I think community health centers cannot exist without social workers and social service workers because, number one, not just for the kind of clinical counseling aspect of it, but I think, you know, I've done social work for a long time, and I know when you are meeting clients, the approach that social workers, social service workers are trained to deal with issues is what community health centers do. That's why we have a capacity issue. If we had more money to have more social workers, I think we would be able to do a lot of work. I think they play a significant role, and I think there is an opportunity for social workers or the College of Social Workers and Social Service Workers to kind of push this, you know, agenda of addressing equity through social work and having a very comprehensive and holistic approach of people's needs, right? It's not just you go to the doctor and I only deal with one issue at a time, and your physical problem, even if I cared, I don't have enough time to deal with all the other issues, right? That's why doctors need a social worker to say, can you please deal with this housing and all those kind of things are coming from. In a CHC, you have that already set up. When people are coming through for primary care, they also have the social worker, the dietitian, the navigator, who can then address what is at the bottom of the cliff, right? At the bottom of the cliff is the physical issue, diabetes, right? And the doctor can say, okay, you know, you've got diabetes, this is serious, it's a complicated issue, you need to eat healthy, you need to exercise, and I'm going to see you in 3 months, right? But many of the people that we know cannot eat healthy because of various reasons, whether it's poverty, whether it's where they live and not having the access to fresh fruit, vegetables, or culturally appropriate foods. They can't go to the gym because it's very expensive. So a doctor cannot solve that diabetes problem or managing that diabetes unless you have a social worker who can do something around the food security issues. Or, you know, the counseling aspect and coping with stress, that also is part of a diabetes complication, or hypertension. So I think social workers and social service workers who are doing this are actually even more important than the doctor, I would say. You need a doctor to diagnose and give you medication, but most of the work happens outside of that exam room. And so it is very integral to the work that we do. And so we can't do it without the social workers and social service workers.
Well, thank you. And that was sort of a really nice tie-in to the final comment, actually, that I see on the chat, which is that this member appreciates the idea of helping people not to fall off the cliff, which I think is a great way to wrap up these questions. And that concludes our educational session. I'd like to thank Lieben for a very powerful presentation. I think that helped us to think about all the components and systemic approaches to anti-Black racism and the really inspiring and innovative programming coming out of Taibu, potentially about applications in other organizations as well. So thank you so much, Lieben. On behalf of the college, I would like to present you with a token of our appreciation.
Thank you very much.
Thank you very much. The college has made a donation to the Sawubona Afrocentric Circle of Support, an organization chosen by Lieben. This organization provides support to parents and caregivers who are Black and raising a child with special needs. Thank you, Lieben.
Can I just say, Sawubona has a meaning. Sawubona means I see you. It's a greeting in South Africa. So that's how people greet themselves. They greet each other. I see you. Right? So I think that's also very interesting.
Very nice.
Thank you.
Thank you.